You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to get out of pain and how to avoid back surgery. With us, we have an expert on the topic. He is the desert's leader in pain management, Dr. Roland Reinhart. Dr. Reinhart, welcome to the program.
Well, thank you for having me.
Now, we've had you on the show.
I've been a number of times.
For a long time, probably 10 years ago.
Maybe even 12.
Was it
maybe 15
maybe 12 or 13 years
it's been
ago.
a long time, yeah.
But so for people that don't know you, though, you have a very busy practice in, is it Rancho Mirage?
We have offices in Rancho Mirage and also in Palm Springs.
Okay. So tell us a little bit about your typical patient and what are the different procedures that you do?
We have patients that run the spectrum from orthopedic problems, sports injury problems, cancer, and a lot of chronic pain that hasn't gone away for, a variety of reasons. Some of it, in the desert, we have a lot of elderly people and sometimes just degenerative changes. So we see the full spectrum of pain. So
Are you better now, or how much better are you now than when I first met you, as far as getting rid of pain?
Oh, well.
I mean, are there subtle nuances to it? I mean,
there's a number of things that have changed over the years. There's much better diagnostic tools, and then we have a lot better experience. So after doing probably 100,000 injections, I'm better than I was after the first 500.
Now, what else has changed? I guess there's a lot more pain management doctors in the desert.
Well, pain is a field. It started out in 1993, and that was the first board certification in pain management. And so every 10 years I've reboarded just this last year. So there's certainly been a growth in the field, the number of people in the field. There are a number of people doing pain management that aren't board certified. So that's one thing. And
okay.
Board certification just assures that there's some level of knowledge and expertise that you have to have.
So there's more training if you're board certified as a pain management physician. Is that correct?
There's more training, and not only that, you pass an examination that certifies that you actually have that knowledge base that's expected.
Would you say about half of the doctors in the desert are board certified that are doing pain management?
That's probably about right.
Okay.
Maybe only half are board certified.
Now, people always ask for referrals, and they'll go to the website at wellnesshour.com, and we don't give referrals. People always need to know these are real interviews. I'm not on your side here. I'm just asking the questions. But I always say, go to a board certified physician in that particular specialty, because it doesn't cost more to go to somebody with those type of credentials.
Right.
Is that right?
Well, that's exactly right. And in fact, actually, it's in our particular case, it may cost even less because we are an independent facility. We're not. I would just say, as medicine's changed, a lot of physicians are owned by foundations or hospital groups,
okay,
where you actually incur extra facility charges every time you see the patient, and those can be as much as 5 times more than what the actual doctor is charging. And then if you have procedures done in those facilities, those are often much more expensive. So your out-of-pocket cost, if you're paying a 20% copay, is going to be quite a bit more money. And if you're a private pay and you're paying that 20% out-of-pocket cost, you keep incurring those, you may see your own rates rise, but your own out-of-pocket just going to those sort of
okay,
physicians or facilities is going to cost you more money.
So I understand this. Okay, so if somebody's in pain, they need an injection, for example, right? Epidural, right?
Right.
And they're still called epidurals?
Right.
Okay,
They are, in fact. Yes.
So I haven't talked to you in a long time, right? But so if you go to a hospital with a qualified, because they have great hospitals in the desert,
right,
everybody knows that. But if they go there, their out-of-pocket copay will be more than if they go to you because you're independently owned.
Right. For every physician.
Is that right?
That's right. For every physician visit, there's going to be a facility fee that's separate from the physician's fee. And then the cost of the injections itself in a hospital setting is going to be more expensive.
So even though insurance covers it, it may be like what, $100, $150 out of pocket to go to a hospital for pain management than to go to you.
Probably your extra out of pocket for a single visit wouldn't be that, but cumulatively.
Because like 3 injections, let's say.
Yeah, so you may have 150 just on the office visits, plus you may have incurred greater costs every time you have an injection. Right. And that, so your total cost may be $300, $400, $500 over
so like
a course of treatment.
$750 more.
Well,
that's very interesting. I didn't know that.
Yeah.
So well, that's a big advantage then, to go to an independent.
What's independent?
Because it's less out of their pocket.
Correct.
I have a 78-year-old father, and so I didn't know that. I didn't know
Yeah.
he doesn't live in the desert, but
Well, we also have our own certified surgical center as opposed to just doing them in the office. Now you can get them done cheap in an office, but nobody inspects an office. So we have an accredited certified surgical center where we do our procedures. So you have the best of everything, a physician who's board certified in a facility that's certified by the state and accredited by an accrediting agency.
Good.
So you get really, I think, the best possible care.
all right. So board certification, though, because you recommend that. That means if you're going to go to a doctor, you should go for pain management, whether it's you or somebody else. Ask them if they're board certified in pain.
Well,
Is that
sure.
right?
Exactly, yeah. Because you could be board certified in something else. You could be, for instance, I'm double board certified. I'm board certified in anesthesia and board certified in pain management. But being board certified in anesthesia does not make you a chronic pain management physician. That is why there is a separate board.
Okay.
So, just like anything, you'd want to ask. A lot of times, people don't want to ask questions like, are you certified? The expectation is, well, you're a doctor, so you have all these tools and knowledge. Well, that may or may not be the case.
And you take, Medicare and insurances and everything else.
Correct.
And,
We do.
And but my question though, back, are you better at getting people out of pain now than you were even like 4 or 5 years ago? Do you think?
Well, I think we always get better as we have experience. But I would say, comparatively, some trends are a lot of doctors are going from offices to offices. We see a lot of doctors that maybe come to the desert and then they're in some other office the next day. The advantage is we're there all the time. And so if you call, we're always there. It's not like, well, the doctor's not here till next week, which some of these other offices have.
One of the nice things, and I'm not trying to be a fan of yours, but the nice thing, because people, I always people want to talk to me about these kind of things all the time, and they say that one of the nice things about Dr. Reinhart is when I go to see him, I get to see Dr. Reinhart, or I get to see the same doctor.
Right.
Almost every time.
Right.
Whereas
Every
if you
time.
go elsewhere, every time. Okay, so when you go elsewhere, you may see different doctors. But why is that really important?
Frankly,
Why is that important?
it's important because your history, your medical condition, whether you're seeing physical therapy or whether you're seeing your family doctor, if you think about it, you want the person who knows your case, knows what's going on, and from particularly where you're having procedures, from procedure to procedure, understands what your reactions and responses are. You wouldn't want to have your primary care be a different doctor. And interestingly, that's a trend that is happening, unfortunately, in medicine, where if you're admitted to a hospital now, a lot of times your own doctor won't see you. You'll have a hospital doctor see you. So there's a lot of changes in medicine, and I think that having your doctor treat you and follow you all the time is a better benefit for you in terms of keeping your care safe and consistent.
Now, in the world of pain management, for people that don't know you, I guess and I don't know if this is, but I think this is the way it is. I think I understand that there's some pain management doctors that just do medication therapy. Is that right? Or manage the medications. And then there's some that do a lot of procedures and medication. That's you, right? You do both.
We do both. We have probably about a 50-50 mix or so.
Give me a list of some of the procedures you do.
We do epidurals. We do injections of joints. We do, including faceted joints. We do procedures that put nerves to sleep for extended period. We put in spinal cord stimulators. We put in intraspinal narcotic pumps. And we have a
like
new
morphine drips kind of thing?
Exactly, but in the spine.
Okay.
We also manage, cancer pain with external intravenous lines, and we do a new procedure now called the mild procedure, which is a potential way to avoid having spine surgery.
Okay. At the top of the show, and for those of you just tuned in, we're talking about new breakthroughs in the treatment of pain. With us, we have Dr. Roland Reinhart. And so this mild procedure, because we said there's new options for people trying to avoid surgery. So what is this mild procedure, and what condition is it good for?
Right. There is basically the three big reasons for having spinal stenosis or sciatica or those sort of problems. And the three big factors are that you may have a bulging disc, you may have arthritis, which is an overgrowth of calcium that takes up space around the spine, and then you may have thickening of the ligament that attaches between the vertebra around the spinal column.
Okay.
So the mild procedure, basically you just go in and you're resecting just that ligament and trying to make a little more space for the spine. The great thing about it is the procedure can be done.
So this is for narrowing of the spine.
Correct.
Okay.
It's called spinal stenosis.
So it is surgically done.
It is
You're doing it
surgically
under
done.
a scope.
We're doing it under fluoroscope, right?
Fluoroscope, okay.
Right. And essentially what we do is go in and we detach the ligament from the bone at the top and the bottom in a single segment, and then we just remove the ligament at that space, which helps to open the spine at that space and take the pressure off the nerve. It's really helpful for people who feel like they can only stand for maybe 5 minutes or so, or people who maybe after 5 minutes of walking are looking for a place to sit down. So there's specific indications for it. Not everybody's a great candidate.
How new
for
is
it.
this?
This has been around probably about 4 or 5 years now.
Okay. The results have been good so far?
The results have been great. The very first patient we did, it was great because she said that the first morning after the procedure, she woke up and she started crying because the pain in her back was gone. And it's just heartwarming. And every one of the patients that we've done so far has had really wonderful results in terms of their pain relief, ability to walk further, ability to stand, and really has had an improvement in their life.
Not a lot of guys in the desert or nationwide doing this procedure?
It's
Yeah.
it's a relatively new procedure, and so it's growing. It's growing.
And so the results have been great.
Results have been really, really remarkable.
But back to the training and experience and things like that. Do you ever? And I'm gonna I know you don't want to talk about this, but are there inexperienced guys or brand new guys in the desert for pain management that some of the maybe because of their lack of experience they end up in your lap?
Well,
Does it? I mean, have you had?
well, we've had some patients. I mean,
So give me an example.
we had a patient the other day. They had gone to another physician, and they had 3 injections. And on the surface, looking at their scans, those might seem like reasonable things, but there was a small problem in their spine where their spine was out of alignment. And when you see that on an MRI, MRIs are static tests. They're done, the patient's back is supported and they're not moving, and they say don't move, they take the pictures. But when you see this offset, you have to wonder if their spine is actually unstable, so that when they bend and flex and twist and do whatever, does their spine move around? In those cases, in some of those cases, particularly if the spine is really unstable, they really are going to need surgery. So unfortunately for this patient, they went through 3 shots. They said they had no results at all. So we get them, look at the scans, and basically sent them out for the next diagnostic test. Again, so many of the diagnostic capabilities are so much better now. So we sent them out and found out that their spine, they actually had a lot of instability. And unfortunately, even I couldn't help them because they really needed spine surgery. Now, this
So
person,
do you think if they would have gone to you first, that maybe you could have avoided all 3 of those injections? Possibly?
When we see the misalignment of the spine, we send them immediately for the x-rays. Now, we would probably do 1 shot to see if they got better, because maybe they'd get better and they'd be better for 2-3 months, and maybe that would be adequate. You may be able to repeat the shot. But in the long run, this person's spine was so unstable, they really needed to have surgery. And that, again, that's just, I think, some experience instead of just doing shots and going, well, you're not better, too bad, is really to try to hone down what they really need and try to give the most appropriate treatment.
I always feel like everyone in the desert knows you, right? That anybody that's in pain has already probably saw you or whatever. But, according to you, there's still thousands of people in the desert that are in pain that don't have to be.
Oh,
is that true?
There are so many more options today for controlling pain, and really.
But is that true that there's maybe thousands of people in the
absolutely.
desert that are in pain, walking around in pain, or staying at home in pain that don't have to be?
Absolutely. And sometimes, sometimes we have patients who'll come in and they'll say, well, my doctor said I'm old, I just have to live with it. But I would say, there's more and more options, more and more options today to help people. And I think that, I have to say I admire primary care doctors. There's so many, there's blood pressure medicines, there's antibiotics, there's so many things for them to keep track of. Since all we do is pain, we basically have access to and utilize the latest treatments, medications, injections, other procedures that can help to get people out of pain and improve their life.
So some pain patients are being managed by their primary care physician. And you've said before on the show, right, that the biggest problem in pain management, or one of, is that they're under-medicated.
That has
Do you
been,
still believe that?
that has been
And elaborate.
that has been the case. I mean, studies over a long period of
They're
time.
under-medicated.
Over a long period of time, those studies have shown that people typically, into looking at barriers to pain management, the patients may be under-medicated because they're worried about pain medicine. Their doctor may be worried. And nowadays, there is, as medicine is changing too, and there's been some problems with increases in number of overdoses with prescription medications. So the DEA is pushing on pharmacies. Pharmacies are pushing on doctors. Doctors are worried about things. And so it's a matter of using the appropriate drug in the appropriate patient. And frequently, pain may not be a narcotic sensitive issue. It may be that they need a different type of medicine. Not all pain is narcotic sensitive.
Do you switch people off medications or different chains of medications?
We do.
Oftentimes?
We frequently do.
Really?
Yeah.
Even if they've been on that medication for 5 years or 7 years or?
It depends on if that's the appropriate medication or not. I mean, if people are coming to see us, it's typically because there's some problem, with their medication. Either their doses are getting really high, or they feel like it's not effective. Or frequently, for our patient population, there's just complications with taking the medication, constipation or thinking, or some other side effect that's intolerable.
Now, you always say you treat pain like an emergency.
That's right.
Like if your own mother's in pain, you'd want her out of pain.
Well, that's true. And most people, if you look at why do people go to their doctor, why do they go to the hospital, other than routine, physical exam or something. I mean, pain is what drives you to the doctor, right? I mean, if you have pain, if you have a lump on your back that's hurting, well, you might go see your doctor.
Right. Well,
or you might just laser it.
You're bringing that up because I told you I had a little lump on my back and I fixed it with a cold laser.
Right.
And then you were very skeptical. So very funny. That was a good one.
No, well, we have a cold laser. Yeah.
You have a cold laser too. So you are using some, like a cold laser is what's considered like an alternative therapy.
Right. Well, we do pretty much any therapy that's out there for pain management.
So a chiropractor also, you use them?
Absolutely. We work with a lot of chiropractors, and just the same as I'd say, I wouldn't pretend to be a chiropractor. We use those modalities where they're appropriate, and so just like I'd say use a board certified pain doctor, I'd say use a doctorate of chiropractor. Why wouldn't you use that?
Now, what do you want chiropractors to know about you? That don't know you, or maybe potentially could be sending you patients and you could work together?
Well, we work with a lot of chiropractors to start off with, but there is, I think that there's a place for every modality, physical therapy, chiropractic, and, within the realm of what we do, we can often help in terms of decreasing inflammation, and then the chiropractic treatments can be much more effective. So, and chiropractors, I find, they run a wide variety of different types of therapies. Some use electrical stimulation, some do more adjustments, some tend to use drop tables or more aggressive maneuvers to manipulate the spine. And I think in the appropriate patient, all of those therapies, just the same as in pain management, anything I do, is picking the right therapy for the appropriate patient.
Now the snowbirds.
Right.
Do you get a lot of snowbirds?
We do.
Do they? How do they?
The whole desert does.
Now, by the way, do you get a lot of people though that in Canada that they were in pain and then they see you and they go, "How come it worked with you and it didn't work over there?" Does that ever happen?
Well, Canadian and otherwise. I mean, a lot of times in Canada they can't get therapy at all. Yeah. But we've had people who, for instance, we had a gal from Chicago, and she'd had I think 3 injections in Chicago. Didn't really get any relief. She came in. We went over all of her scans, and sometimes it's the approach you take. The injections that she had were really best for treating a nerve where the disc is bulging out towards the side, and her problem really was more central. So basically, in going over the scans, explaining to her where the problem was, we adjusted the injection, I think did it 1 level higher, and she's been 4 weeks now without any pain. So again, I think sometimes...
Does she get frustrated, by the way?
Well,
She says,
you have treatments you expect to get better, and
I mean, you never like to brag about yourself, but do you get frustrated then? Like they missed it, like 1 level higher. I don't know what that is. Is that like an inch higher?
Well,
what's 1 level in your world? Is it a centimeter? What
depends
is it?
on the size of the patient, but it's.
Is it based on bone?
I think exactly. Well, it'd be the bone height, but it's there's tissue planes, and you want to make sure that you're in the right area where the problem is to treat the patient. It's more, I don't get frustrated. I'm always trying to think just the same as if I don't get a result that I expect is, well, why didn't I get that result? So I expect that things should work and it should make sense to me for where I'm treating the patient, that the patient is in fact going to get better. And if they're not, then I'm questioning, okay, why aren't they? So, and I think that's, that's a process I think probably all doctors go through, maybe to different degrees.
So your referrals, you get a lot of doctors that said you patient. What about orthopedic surgeons? Because that's where they go when they're in pain sometimes, or no?
Well, no, yeah, well, absolutely, because depending if you think it's your hip or something, you're gonna go see an orthopedic surgeon, or if you go to an urgent care center or whatnot. But
now the largest orthopedic center in the desert, with great reputation, they're hospital owned. Correct. Is that correct?
That's correct.
And I think we talked about earlier on the show that it's more expensive out of pocket as far as copay to go to a hospital-based pain management physician. Is that true, by the way?
Well, it is. It is, because there's a facility fee involved.
That's like almost worth a news conference.
Well,
because that's surprising
it's
to me,
one of
by
the
way.
trends. It's one of the trends in medicine. I mean, the government, there's
so the hospitals get more reimbursement than you.
Correct.
And because they get more reimbursement than you, even though you have a full accredited OR,
it costs the patient
so the
more,
patient
right.
ends up having to pay more,
Pay
even
more
though
money.
their insurance is paying for it.
Right.
So I think the public just think that insurance is going to pay for, whether I go to a hospital, whether I go to Dr. Reinhart, they're going to pay the same, but they're not.
Well, that's not true. Right.
They're
not
actually going to pay more out of pocket.
It's more out of pocket
to a hospital. That's interesting to me. Are you sure that's correct?
That's absolutely correct. Absolutely.
Do you think
correct.
very few people know that?
I don't think they do.
Has it always been this way?
No, that's one of the trends.
Like a couple years new?
Probably in the last 4 or 5 years, and it's partly the number of independent doctors 5 years ago or so was maybe around 60%, and now it's down to 30%, largely because there's a lot more administrative management that has to go on. The government requires a lot more reports, a lot more information. You have to ask a lot more questions, and the overhead burden of dealing with the administration pushes doctors, because your overhead just keeps going up, pushes doctors to either join a hospital or hospital foundation or an HMO group or someone else to try to get out from it. Doctors didn't go to medical school to do paperwork.
Yeah. Okay, well, and that's another issue. But the bottom line is when people go to a pain management physician, they're in pain. They want to get out of pain.
Right.
Okay. And if there's a board-certified pain management center, and if it costs me $150 more to go one place, when there's going to be similar things performed, you might as well go to the less expensive guy with the most experience.
Well, more experience, yeah. It's not...
In my green room, what you wanted to know, I said, what do you think you do better? And you didn't want to say, but you did say, I think I listen. But why is that so important? Because I look at it as there's a procedure, you have an MRI or whatever, it's straightforward. Why is listening so important?
Well, again, the MRI is a great tool. So is there's now SPECT scanning and other types of scans. But it takes the patient to explain what's going on with them, and then you've got to integrate all of that information. So sometimes the wait in our office is related to, if the patient's going to tell us a story about what's going on with them, we're going to listen to the story, because hopefully, the idea will be we're going to get a better diagnosis, a better treatment,
because you listen.
better
Do patients
outcome.
ever say, like, you listened? Or it was like a different kind of experience at your office?
Oh, frequently, because I'll
Frequently,
sit down.
like every day, they say,
every day.
I can't believe you listen to me.
Well, more than that, we draw pictures and explain to them.
You do?
Yeah. I'm not a very good
I
artist
think you never
either.
told me this, by the way.
Not
You've
a
been
very
on my
good
show,
artist.
what, 10, 15 times?
Something
You
like
never
that.
told me you draw out
I draw
illustrations.
pictures. I'm not the greatest drawer, but we use models, and we explain to them what's wrong with their spine and how we're planning on fixing that and the expectation we have.
Is this common practice, by the way? Where you draw things out?
This is common for us. I typically always draw pictures of the pathology going on in the spine, and then if we have the images too, particularly like when we do a mild procedure, we'll go over where the pathology is, where we might be able to help.
Do people ever, and they probably don't, but do people ever go to you for second opinions? That means they went to one pain management, now they're getting a second opinion?
We frequently do. We frequently have other opinions, and again, I think just going through, putting everything together and looking at what's going on and trying to make an intelligent decision
Is your
about what might be
opinion,
helpful.
because it seems, again, not to downplay what you do, but it seems that one pain management physician is going to have the same opinion as the other, if it's pain in the back or whatever. So what do you differ on opinions? Is it really what procedure you're going to use? What angle?
Well, I would say that's not actually true. Probably anywhere in medicine, if you go to 10 surgeons, you've got 10 different opinions, and there'll be maybe subtle nuances about what they think their approach is, and oftentimes that's based again on experience. And so I often ask the surgeon, well, you do a fusion, they wouldn't do a fusion. What makes you decide what you're going to do? And they'll typically say, well, based on their experience, they want to do the procedure they want to do because they understand what their outcome will be.
Okay.
And if they ever let the patient talk them into not doing that procedure, if it doesn't turn out right, they just kick themselves because, they know that they should have done it some other way. And so again, I also realize there's different approaches to different things, and making sure you listen to the patient, make sure the diagnosis is right, and you have the appropriate imaging so that you do the most appropriate thing. And while we strive to keep people from doing surgery, sometimes surgery is the appropriate thing to do, and then there's no point in doing a lot of other unnecessary procedures.
We're out of time. Always a pleasure to have you on the show, and thank you for coming back down here. But I think the main message is this: that there still are thousands of people with neck pain, back pain, people scheduled for surgery that, number one, don't need surgery, possibly, or there might be an alternative, or people that are in pain that don't have to be. Is that right?
I think that's true.
And these patients are just what, afraid of you guys?
No.
They're afraid they're going to be put on a bunch of medications.
Actually, pain management is about not using medications. It's about finding the source of the pain and then treating that source specifically. So it's really not about putting people on medications. So
it's good. Well, I always appreciate you having you on the program. Very interesting always. And your website, they could go there for some information.
Right.
And the take home also is that it's less out of pocket to go to you as an independent.
Right.
Than it is a hospital.
Right.
For a board certified pain management physician. I didn't know that. Like over 3 injections could be $150 less copay.
Correct. Or more.
And I don't think a lot of people know that.
Well,
and I'm not trying to jump on this, but to me, this is brand new news to me. And I'm sure other people don't know either. So
we'll wake up, Randy.
All right. Well, thanks for coming on the show. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, you just caught 5 minutes of it, you can go to our website at wellnesshour.com and just put in Dr. Reinhart. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.